Terry.
Mhm. Charlene.
Trisha.
Tony.
It's your turn, Mother. Introduce yourself.
Sarah.
Cool, thank you. All right. As a single mom working full time and going to school, I have had moments where my mental health has felt like it was hanging by a thread. But the hardest part was not admitting that I needed help. It was discovering that I would have to wait months to get the help I need. Tonight, I am asking you to sign a petition encouraging our state's lawmakers to raise wages and funding for mental health workers so families like mine can access timely care. Mental health care workers are leaving their jobs in enormous numbers, and families are being left without the support they need. I will show you the problem we are facing and the causes behind it, as well as the solution that we can use to start fixing it now. A severe lack of mental health care providers has made it difficult for families to receive prompt treatment when they need it. Millions of Americans live in areas with few mental health care providers. More than one third of the U.S. population, about 122 million people, live in federally designated mental health professional shortage areas, according to Bridge for Mental Health. Long wait times make it nearly impossible for people in crisis to get help. A 2023 national study found that waited a median of 67 days for an in-person psychiatric appointment and 43 days for telepsych. I watched a close friend of mine go through postpartum depression while waiting months for therapy, feeling frustrated, scared, and completely alone. And that stat is according to the PubMed of 2023. These long wait times are not random, they are caused by deep cracks in the mental health workforce. Mental health care professionals are dropping out because they are suffering from burnout, poor wages, and unsupportable working conditions. In the world of behavioral health, turnover is really high. Some contexts some contexts see turnover rates that top 40%, and burnout, secondary trauma, has been listed as two of the most common reasons, according to the MDPI in 2023. Low wages are one of the most common reasons why workers quit. According to a study conducted by the Illinois Behavioral Health Workforce Center in 2024, inadequate pay is the primary factor prompting mental health care professionals to think about leaving their jobs, with excess caseloads and administrative paperwork also ranking high among their concerns. The silver lining when mental health care providers are valued and well resourced and, yes, adequately paid, the impact on our community is tangible. Provide we must provide more compensation and funding for those mental health care professionals so that there is less turnover and a shorter wait time for families. Better wages means better retention and better care. A system of investments in adequate compensation and heedful care of nurses and physicians have been proven as a successful retention strategy for clinicians, according to the MDPI. So there's no reason we couldn't do the same thing with mental health care. When workers are paid competitive wages, which benefits communities with shorter wait times, according to the Department of Health and Human Services report, as suggested by the RAND estimates, states are less likely to face recruitment challenges and fund long wait times for services if they offer mental health care providers 20 to 30% more than the average industry wage. A mental health workforce crisis that is firstly because demand is up, but also the crisis because we realize how few mental health clinicians there are out there, and the ones who are out there are quitting their jobs for less stressful opportunities. We have looked at the problem, what is causing it, and how raising wages can create a stronger, more accessible mental health system. I have been asking you to sign a petition telling lawmakers to adequately compensate mental health care workers and to increase funding to communicate mental health or to fund community mental health centers. If we want to if we want a compassionate mental health care system, we must show compassion to people who hold it together. When we pay mental health care workers fairly, we make it possible for families, especially families like mine and yours, to get the help that they desperately need. Thank you.